With COVID-19 hospitalizations steadily inching up in the U.S. this summer, some hospitals, schools, and businesses are reinstating mask mandates. Two new COVID-19 variants CT.5 and BA.2.86 have recently emerged. The World Health Organization, who classified the former as a variant of interest earlier in August, but reported that its risk to global public health is low. The latter variant has only been reported in the US, the UK, Denmark, South Africa, and Israel as of August 23rd, according to the US Centers for Disease Control and Prevention (CDC). In a risk assessment summary, the CDC wrote that the BA.2.86 variant may be more likely to infect people with existing immunity to COVID-19, either from vaccinations or prior infections, than previous variants. As the new variants of COVID-19 spread, hospital admissions are rising. There were at least 15,000 in the week ending August 19th, but they remain a far cry from past peaks during the height of the COVID-19 pandemic. Masks were widely used as a method of limiting the spread of the virus, especially before vaccinations were available and mandates drew anti-mask protests in some places. While it's unlikely that the country will see a return of widespread mask mandates anytime soon, some places are bringing back pandemic care requirements temporarily in response to recent spikes in COVID-19 cases. Mask mandates in 2023. Morris Brown College, the historically black university in Atlanta, reinstated its COVID-19 mask mandate and other restrictions for 2 weeks due to reports of positive cases among students. All students and employees are required to wear face and masks for 14 days from August 20th. President Dr. Kevin James said in a letter that was posted on social media. The college is also imposing restrictions on the size of gatherings, and parties and large student events are banned for the 2-week period. We prioritize your safety and seek your cooperation in preventing another pandemic, James wrote. Lionsgate. Some employees at Lionsgate headquarters in Los Angeles are being required to wear masks after some cases were reported. The Los Angeles County Department of Public Health is requiring Lionsgate employees on the 3rd and 5th floors of our 2700 Colorado Avenue headquarters in Santa Monica to wear masks due to a cluster of COVID cases, Peter Wilkes, Chief Communications Officer for the company, told ABC News. It is the policy of the LA County Department of Health to require masking in workplaces that have a cluster of cases. Kaiser Permanente in California, the healthcare company, is requiring staff, patients, and visitors to wear masks at its Santa Rosa Hospital and medical offices in Northern California. The requirement is due to a rise in the number of patients testing positive for COVID-19 in recent weeks. Respiratory protection and the use of masking is an important component in keeping our health care workers, physicians, and patients safe, the company said in a statement to CBS News. United Health Services in New York. The New York health system reinstated mask requirements at its facilities on August 23rd because of an uptick in COVID-19 cases. Masks are once again required in all clinical areas at UHS Wilson Medical Center, UHS Binghamton General Hospital, UHS Chenango Memorial Hospital, and UHS Delaware Valley Hospital, as well as primary and specialty care sites, United Health Services wrote on its website. The new policy is in effect immediately for all patients, visitors, employees, medical staff, volunteers, students, and vendors. Auburn Community Hospital, New York. The hospital brought back its mask mandate just a month after announcing its end. Face coverings are mandatory inside our facilities, regardless of your immunization status, the hospital says on its website. If you do not arrive with one or yours is deemed inappropriate, a mask will be provided to you. It must be worn at all times and must cover your nose and mouth. Upstate Medical's hospitals in Syracuse, New York. Both of Upstate Medical's hospitals in Syracuse University and Community General reinstated mandatory masking on August 17th after an uptick in COVID cases, effective immediately. Mandatory masking is required by all staff, visitors and patients in clinical areas of Upstate University Hospital, Upstate Community Hospital, and ambulatory clinical spaces, said a memo sent to Upstate staff that was obtained by Syracuse. Clinical areas are defined as any location patients gather, wait, transport through, or receive care. Masking is strongly recommended in all non-clinical areas.